My name is Michelle, and I live here in Portland. I am here at Shelley Pingree's office. I was actually hoping to find more people. The representatives will be voting on a universal health care plan in D.C. this weekend. My guess is that Pingree has not read the entire bill. I called, but I wanted to make sure that my voice was heard, so I've also come down to her office to write a little letter to ask if she indeed will be reading the bill before she signs it. I used to be a universal health care proponent. I thought it was a great idea. I thought most people deserve and need health care. And then I started meeting some people from Canada that were coming to Boston for cancer treatment. And when I questioned them, I couldn't really understand why they were paying out of pocket when they have free care in their own country. And as I talked to more and more people, I found out that they don't get to choose their own doctors. They're assigned by district, by where they live. They also are denied care, or the care is such a long waiting list that they'd be dead, in fact, by the time they actually received the care. So I really started, the first few people I met, I thought, well, maybe there's some circumstances that I don't know about. But then over the years, as I've questioned more and more people as to why they're in the U.S. getting care when they do have access to free health care, it's substandard, they have to wait too long, and they basically lose their choice about a primary care provider. Right now they do lotteries. A lot of times they don't even have primary health care providers. They have to wait, and they call about 2 a month to get on a primary care provider. So I'm very frightened about this new bill, what it has to do. For one thing, I'm afraid we, with private health care insurance, will lose it because the competition won't be fair. The government is actually going to lower the payments so that the cost of care is more expensive than what they're being reimbursed. So that's going to have to be made up somewhere. Again, either taxes or higher premiums for those that can afford it. So I'm very concerned about what is going on with the healthcare reform. And again, one of the biggest concerns is that an almost 2,000-page document, I want to know who's going to actually read this before they sign it, and why the big rush to sign it if it's not even going to go into effect for years, supposedly. So let's slow this down and really find out what we're signing. I hope that people call their congresspeople and just at least ask questions, find out, why they want it, and if they're indeed going to read the bill before they sign it. So that's all I have to say.